Hey there, Dee here from Front Office Guru. In this quick video, I'm going to talk to you about the effects of pain and how that can keep us from getting our patients the care that they need and deserve. Now, if you think about it, the average patient comes to us when they're in physical pain or they're having a painful problem in their life. Physical pain is pretty obvious for all of us. If you've been in pain before, you understand what that is. But a painful problem in life can be something that they're suffering with. In physical therapy, it's something like, well, the patient isn't able to climb stairs anymore, or they can't drive themselves to and from the grocery store or the doctor's office, and they have to rely on someone else's help. In each of those cases, there are three main factors that are going to keep us or make us struggle more to help the patient get the care that they need. The first one is personality. Think about your personality when you're in pain or when you're suffering with a painful problem in life. You're distracted, you're grumpy, you're not really wanting others to be around you, right? So that's the first factor, the first thing that's affected. The next one is communication. When you're in pain, your ability to communicate well with others and your ability to accept or hear and understand someone's communication is also diminished. So you have a patient who is in pain, they're not necessarily taking in everything that we're saying to them. They're not necessarily communicating with us at the level that we need them to because pain gets in the way. It's not the patient's fault. It's something that we all need to understand. These two factors are very important in our ability to help us care for our patients and get them the care that they need and deserve. Now, the third factor is played into by the first two, and that's someone's decision-making ability. Think about it. When you're in pain, you don't want to make decisions. You don't want a lot of choices. You don't want somebody hammering at you. You really are struggling to make decisions in life. In fact, they say when you're in pain, you really shouldn't make major decisions in life. And that's something that we all need to look at. So here we are. We have patients. If we're offering them times, if we're giving them too many options, if we're asking them what they want, in many cases, they're not going to communicate at the level that we need and want them to. They're not even going to be able to follow along because, you're giving them too many options or you're asking them what they want. Think about that. If you ask me what's a good time this week, that opens up 168 hours in the week, and that may be too much for your patients to confront. So based on all the training that we've done this week, the most important thing to remember is that when you're working with your patients, you need to keep things simple. You need to get the data that you need. That means don't give up. When you need something from a patient, get it. It's so that we can help them get the care that they need and deserve. Understand that when somebody's grumpy with you on the phone, it's not necessarily the patient talking. It really is the pain talking. And if you think about this, you've had a patient in life who the first time you talk to them on the phone, you're like, oh my God, they hate me. And then 3 weeks later, they're coming in as their pain is diminishing and they're like, oh my God, I just love you guys. You're the best ever. Thank you so much for giving me all this care and helping me. Remember, that's a big part of this. Pain gets in the way. Pain can alter our patients' ability to get the care that they need and deserve. So the person they rely on most is us. It's our job to lead and guide our patients so that they get the care that they need so that they can recover fully. All right, I hope this helps. I look forward to having you join my Front Office Guru family, but hopefully this helps you to help your patients at a better level. Have a wonderful day.